Hi everybody, it's Professor Miller. Just wanted to go through Module 2 real quick just to kind of give you a brief overview as to some of the content that's up, and then I also will go over the assignments for this module as well. So our first module kind of looked at, healthcare transformation and practice changes for the APN. So this topic is more about health policy and the implications for both our professional practice and for patient advocacy, essentially. So in the top, obviously, like I always do, I put the Module 2 readings and assignments in there. The first section, I have some information about APN practice and current recommendations. As I already introduced the Institute of Medicine, the future of nursing, I already brought that kind of up within the first module. And it's, that general guiding document towards the future of nursing, essentially, and pulling nurses out into the community and expanding our roles to meet the needs of our populations and healthcare transformation, essentially. I also put up this PDF file right here, looks at these current recommendations in particular to forensic nursing. So just to kind of put it in perspective for your own practice area, I did put these two documents up. This one's obviously for AANP, for the nurse practitioner students, so same kind of thing as this one above. Another thing that I want to introduce within this module is the consensus model for APRN practice. It's actually a very prominent document, kind of like the Institute of Medicine, but this is actually more towards our regulations of our practice. And it's based on, actually this kind of goes along right with it, the LACE document. And it looks at licensure, accreditation, certification, and education. And essentially this consensus model is for the 4 APRN roles. However, for forensics, this is another area that I encourage you to look at as well, because it's kind of, your practice is in the same realm. And you really got to look at it from the same exact perspective. So essentially what it is, it's a guiding document to create uniform practice, regulation, certification, and education across the U.S. So, this kind of will help get rid of those barriers that we have of practicing within different states, having an alignment with the education for entry to practice, like is it an MSN or is it a DMP? So it looks at all of these factors and gives recommendations for across the U.S. for practice. So this is strictly based on APRN practice, essentially. So that's something to take a look at, too, because this is another document that's really important for our practice. The next one is role of NPs reinventing primary care. It's just a good PDF file to look at, supporting our practice and, our integration within the system. Same thing with nursing the primary care shortage. It's just another good document to look at. I do have you'll find it throughout the course, I have some videos that I put up about prescriptive authority or collaborative agreements. I do put some videos up about it just to explain what our prescriptive authority is in Michigan for nurse practitioners, so that's something to take a look at as well. I know there's a few forensic students that have actually talked about going back to for their postmaster's NP certification. So it's always good to have, to look into this stuff anyways. And really, like I said, your role as a forensic nurse is most likely going to transition to a role very similar to like an NP. So it's always a good area to kind of look at as well. Some of these documents are from AANP or our MyCamp website, so it looks at prescriptive authority, and I do go into detail about each little area within this video. The next area is looking at our scope of practice, the national and Michigan. That's what I really kind of want you to get out of this module is, one, looking at the regulations surrounding your practice and how you foresee your practice changing over the next, few years, or where you foresee the practice of forensics or nurse practitioners heading in the future. So I have up our general ANA scope and standards of practice, and obviously this is the standards of practice that all of us registered nurses follow by. I did put up the one that's specific to forensic nursing, so I do want you to take a look at your scope of practice. Same thing with APRNs, I put up the scope of practice document as well for this. This video here is another one that I go over NP certification and scope of practice specifically within Michigan, so you can take a look at that. Same thing with collaborative agreements. I did post up at the very top of our website about HB 5400. It is now a public act, and it has changed our practice. So this will kind of go into a little bit more about prescriptive authority for nurse practitioners. Unfortunately, For Medicaid and Medicare, we need collaborative agreements. So just take a look at that because I want you to kind of understand your practice in the state of Michigan. Same thing with this, just another document. This is, I think it was from 2013, so it's a little bit old. It looks at, or no, I'm sorry, I think it was 2015. It looks up or at our practice across the U.S. And the changes that have been made. And like I said originally with the consensus model, we're trying to get the states to, partake or uptake the consensus model. So this kind of looks at each individual state and kind of where they stand against it. With this module too, I also wanted to discuss a little bit about evidence-based practice, which is part of our second assignment for the module, looking at innovations within practice. So it's really understanding evidence-based practice and looking at that evidence and how it guides our care and if there's changes that need to be implemented. So I just kind of want to get you thinking along those lines of innovative practice. USPSTF guidelines, I have a video up about it right in here and it kind of explains it more in detail. It guides our practice. It's a lot of the preventative care that we follow, essentially, these guidelines. Same thing with forensics. There's specific areas that are applicable to forensics, so take a look at that as well. These next 3 documents I put up for forensic students as well. Obviously, it can be for NPs too, but it looks at, sexual violence, sexual assault kits, and mainly, I put this up mainly just to kind of get you thinking of areas of practice that you feel like could be changed, even within your work setting. So it's just to kind of get you thinking of areas that you feel like you could implement potentially. The next one, evaluation, outcomes, and transparency. Evaluation and outcomes, as we move through the course, I think it'll come a little bit more clear. It's extremely critical to our practice. We have to evaluate our care. We have to make sure that we're providing care that does meet positive patient outcomes, along with transparency. Nowadays, with reimbursement, everything is based on outcomes. We used to have a physician fee schedule where you were reimbursed for each for certain criteria, or if you would bill for certain diagnoses, and then you would bill for certain procedures. Well, now it's a lot different. It's value-based care, so we're looking at health outcomes, and you have to meet these outcomes in order to get reimbursed, essentially. So that's why it's so critical to be able to evaluate your care and implement changes, within your healthcare system or your practice setting. Same thing with, I do tie this in a little bit because it's another critical factor, is transparency. And why EMR and health IT are so critical as well, because this is what, not only do we use it obviously for reimbursement and documentation, but it also is used for data. It's used for looking at our health outcomes, looking at quality of care. So this video goes a little bit more into it. And another important factor too, like when we talk about incident to billing and reimbursement, is I think I discussed it in a previous section, but you'll find a lot of times that NPs are billing incident to, because when you're working in a physician practice or, side by side with a physician, even if you're a forensic nurse and you're billing, unfortunately, practices tend to bill under the physician because we get more payment. Nurse practitioners only get 85% of the physician fee schedule. So you'll hear the word incident to because they're actually billing under the physician versus the nurse practitioner. Well, the problem that, comes up with this is that it's all documented under the physician. We're not getting any tracking or, they're not looking at our health outcomes because it's billed under the physician. So it's an issue that we're kind of presented with. So that's just one other area that I kind of wanted you to think about a little bit with this as well. NP patient outcome process. This is just another evaluation tool. This you can use further, like later down the line when you're practicing. Some other supplemental journals that I also put up, Flexible Healthcare, Flexible Regulations. It's actually a great journal article because it's from the Journal of Law and Health, so it's outside of the nursing profession, looking at, competitive healthcare with different types of providers to have a market that essentially is fair. So it's just a good article to kind of take a look at. These are, this is from AANP, NP talking points. So like if you're ever developing a one-pager or something and you're looking for, some evidence to back up what you're saying, these are also good areas to look at too. Same thing with reimbursement. And same thing with forensics. You can kind of take a look at this stuff because it can help guide you with areas to think about or areas if you are writing a letter of like kind of how to add your perspective into it. Because that's another important factor too, is when you're writing a letter, to, let's say, to your legislator or anybody, for instance, we can't always make it about a me issue. Like if it's about our practice, you always have to turn it and give them the importance of how it affects population health and, access to care. Because they're much more apt to listening to you if it's not just about us, if that's what you're writing about. If you're writing about, changing our practice regulations, it's important to put that perspective of the patient in there as well. These I just added two as well, because these might help you get you thinking about different innovations. This is from the Family Violence Prevention Fund. It's in initiatives and guidelines. So they're just good areas to kind of look at. This was a good article too, disaster preparation, community response to domestic violence. Like I said, you can use these just to kind of give you different ideas about areas that you're interested in, potentially for your assignment. So let's take a look at these real quick, our course activities. The first one's your practice innovation assignment. So in Module 1, we looked at, some of the concepts surrounding healthcare transformation, political advocacy, and then APR and practice with the U.S. healthcare system. So now within this module, we're going to look a little bit more specifically at our practice in that two different areas. Essentially, one, the issues and the regulations surrounding our practice, and then secondly, health policy as it relates to the patient or population health services that we integrate within our practice. Module 1, the biggest thing that I want you to understand with that is that the transition of value-based care, health outcomes, looking at data and population health, just that whole, that global look of it. And then also with Module 1 of understanding that that nursing is really, it has changed a lot over the past, previous years, but nursing is going to be well integrated within our healthcare system. So it's taking on these new roles, stepping out of the hospital, having innovative practice. So it's just to kind of get you thinking on those lines. So this assignment's directed towards meeting the second objective of making sure that you have a better understanding of health policy and its direct implications on patient outcomes. So you'll hear me talk about patient outcomes over and over again, because that's really that's what we need to be focusing on. So as an APRN, leadership for healthcare transformation, it usually comes natural over time. It's just like everything that you do. But we do have to consistently evaluate our care, our guidelines, and policies. And this is the first step to positive change. So this assignment, I want you to take a topic. It can be any topic that you're interested in. It could be from your practice area currently. It could be a practice area, your future practice area, or it could be anything you're interested. But the whole thing is looking at, the process of care or a guideline, and basically trying to figure out a way to improve it to facilitate positive patient outcomes. So like I said, you can go very broad with this area, or you can go very specific. It kind of depends on the area you want to look at. And then I do have them sectioned off into threads that you can branch off from, that you can kind of fit them under. And then obviously discuss a few different areas that I have listed here. Your background factors and issues surrounding your topic. So just do a very brief literature review surrounding the topic, like what is the issue, what's known about the issue, what's not known about the issue, and then why is it significant? Why is it significant, for patient outcomes? You can look at practice guidelines. You can look at care delivery models, like if there's a certain program that you were looking at or implementing a program. Obviously, look at some literature that's supporting the changes that you're recommending if that's the route that you're taking. And then next, if there is any guidelines that are out there or policies or rules or regulations surrounding that topic that you're choosing, present them as well. And then if not, what are you recommending, or what kind of solution are you recommending that would facilitate this process? And then how does your practice as an APRN fit in with these recommendations or solution? And then conclude with your final recommendations and the outcomes you wish to achieve. So this assignment's 50 points. This is one of the main ones for the course. It's your first posting, just have it up by the 8th of October. And then to receive all allocated points, we'll have an open forum discussion till the 15th. And then when I go back to the first page, I'll show you as well, because there's an actual link for an assignment. So put it in the forum and then add it as an assignment link to me too, just for grading. And that way I can give you personal feedback on it as well. So these are some of the topic threads, and I'll try to give you some examples. If you're still having a hard time finding an area, just let me know because I can give you some previous examples, more examples to look at as well. So the first one's integrated healthcare teams, like federal healthcare centers, nurse-led centers, transitional care for either children, chronic illness, or you can even look at transitional care, for the sexual assault victim, follow through with the patient. You can look at transitional care for the older adult, care teams for sexual assault victims, etc. So any kind of process that would include a team. Another area is older adult chronic care, and this can be specific guidelines. We could look at CHF guidelines or, implementing these certain guidelines within your practice area. It could be related to end-of-life care, palliative care. Another area, too, is evidence-based practice. There's tons and tons of topics that you can focus on with this. It may be preventative care guidelines or certain guidelines that are utilized for a certain diagnosis, like hypertension, CHF. Or you can go more specific to forensics if you would like to. Quality care, this can look at like health IT transformation, EHR regulations and tracking, U.S. quality care measures. So it's looking more at that perspective versus a direct patient care process. Another area, too, is public health topics. This actually, a lot of people tended to do public health topics because there's a lot of areas you can look at. For instance, these are just examples, like lead level screening in children. Just think about like the Flint crisis that we had not too long ago. Immunization practices or policies surrounding immunizations. For instance, they were trying to recently change the process in which parents receive vaccine waivers. Or you can look at like EpiPen policies. So you can go very specific here, or you can go to a more broad area. Newborn screening, forensics, there's tons of areas that you could probably fit under this topic as well. So just post your posting under the one it best fits, that you find that it would go with. Obviously, you don't have to do each area. You're just going to pick one area. So going back, like I mentioned, so place it in this form and then also submit it to me as an assignment so that way I can give you personal feedback too. Module 2, reflection forum. This is just a reflection forum. Same thing it's due on the 8th, responses by the 14th. So what I want you to do with this, I don't want you to spend hours upon hours on this, but I want you to have a good understanding of your practice. And I want you to understand where you foresee forensic nursing going, or your nurse practitioners, where you see the direction of NP practice going. So forensics, look at your scope and standards of practice. Look at the forensic nursing one, and you can even look at the regular ANA general standards of practice. And look at the current Institute of Medicine recommendations. So look at these recommendations and then basically define your professional practice within forensic nursing. How does it align with these recommendations? Do you see that it fits, or what do you see that you would like to see developed further, essentially? So what areas of practice do you feel are important to advocate for? Is it gaining prescriptive authority? Is it, branching off into other areas? Is it more independent practice? So essentially, what would you advocate for in order to support continuous growth of forensic nursing? And you can look at, your education, licensure, uniform regulations, certification. Those are just some ideas. So it's really examining your practice and advocating for what you feel should be developed further. Nurse practitioners, view the consensus model for EPR in practice, and then obviously the Institute of Medicine, which we kind of looked at a little bit in the previous module. What are the essential concepts of the consensus model and its significance for APR in practice? And then kind of look at how practice within Michigan fits with the consensus model. And when you're doing this, I mainly mean looking at regulations surrounding your practice, more of like the independent practice, collaboration, and prescriptive authority. Because the consensus model covers education, it covers accreditation. I don't really necessarily want you to delve into that. It's more of like our regulations regarding like prescriptive authority and all that. I just want you to have a general understanding of our practice in Michigan. So that's what this reflection forum is on. It's more for advocating for our professional practice as advanced practice nurses. If you do have any further questions on this, obviously just please email me, and I'd be happy to help in any way that you need. So let's go back to the main Moodle page. So for Module 2, the activities are down here. If you have any questions, obviously let me know, and then I can help you out a little bit further. Um, oh, the other thing I wanted to mention too is this is actually a really, really good video to watch. I know it's a little bit long, but if you can watch at least part of it, it gives you a great perspective on evaluating our care. Because this is really exactly how we need to be practicing and how we need to be looking at healthcare. So definitely try to watch this video. It's a great video to watch. So I think it'll give you a good understanding of a lot of the factors that we really need to consider with practice. So I hope everybody's having a great week. I will post an announcement up in regards to Module 2. And then if you have questions, please email me and I'd be happy to help. And I will also get your Module 1 discussion forum grading back as well. I do try to provide detailed feedback with each one of them, so it takes me a little bit to get them back, but I'm working on them and you should have them shortly. Everybody did great though, so no concerns. If you have any further questions, let me know. Hope you're having a great day. Bye-bye.